Now friends, we are talking about medical lab report regarding blood test. So the first term is related to blood is hematology. What is hematology? You see here. So hematology is a branch of medicine to treat blood and its components. So this is a hematology medicine branch. Now the second term is CBC, complete blood count. What is CBC? You see here. So here CBC indicate count of white blood cells, red blood cells, platelets, RDW, MCV, MCH, MCHC and concentration of hemoglobin and hematocrit. What is hematocrit? Volume percentage of RBCs is known as hematocrit. So CBC is also known as full blood count or hemogram. CBC, FBC or hemogram. Now the third term is EDTA. What is EDTA? You see here. EDTA full form is ethylene diamine tetraacetic acid. Ethylene diamine tetraacetic acid. Friends, it is used as anticoagulant blood collection tube. It is a anticoagulant blood collection tube. Friends, EDTA used for CBC and it is a based blood preservation vial. Friends, EDTA is an anticoagulant which is prevent to blood clotting and its color is purple or lavender cap. Now this term hemoglobin denoted as HB and its unit is gram per deciliter. Gram per deciliter. It is a unit of to measure hemoglobin. And here friends, hemoglobin measurement method is used by electrical impedance. So what is electrical impedance? You see here. Friend, this is a blood cell counting and sizing based on Coulter principle. Okay, electrical impedance, it is counting blood cells and sizing based on Coulter principle. So what is electrical impedance? You see here figure. So electrical impedance is the detection and measurement of changes in electrical impedance or resistance which is produced by a blood cell when it passes through an electrical field. Friends, blood cells are poor conductors of electricity but suspended in electrically conductive dilute. Friends, two chambers filled with conductive electrolyte solution and separated by a glass tube. You see here, this is a glass tube which is having a small aperture like this, and AC current is generated between two electrolytes when cell passes through the aperture and the flow of current is impeded and voltage pulse generated. The number of pulse is indicated the number of blood cells. So here friend, number of pulse generated is indicated as number of blood cells. So here tubes are having small apertures. Here internal electrode and this is a external electrode and this is a dilute. So now the third term is, now next term we used total leukocyte count, TLC, total leukocyte count. So what is TLC? Friends, TLC indicate WBC, white blood cells are leukocyte in blood stream. If TLC increase, then your body fighting off infections or inflammation. If leukocyte count is decreased, then risk of producing infections. And TLC, total leukocyte count, unit is 1000 per microliter. 1000 per microliter unit of this. Friend, TLC is measured in flow cytometry. So what is flow cytometry? Friends, flow cytometry, it is a laser based technology used to measure blood cells or its particles characteristics. A sample of cells or particles is suspended in fluid and injected into flow cytometry machine. About 10,000 cells can be analyzed by computer in less than 1 minute. So this is a flow cytometry first video on this lab report, and each technique terminology we discuss one by one in next video.